Dr. Alina Valdes, and as Elaine said, I would like to thank her first of all for inviting me to speak in front of you wonderful folks today. As Elaine said, I am a Cuban-born person. I came when I was 6 years old, right after Castro took over, and not being of a wealthy family, let's put it that way. I grew up in Flushing, Queens, in case any of you know Flushing, Queens. Yo, Flushing, right? I always used to think that was a bad name, Flushing. But anyway, that's where I grew up. I went to school there. And I have lived and still am living my American dream. Why do I say that? Because I chose to be a physician. First one in my family, and I was able to complete that. Graduated from New York Medical College in 1983, I don't mind saying it, because with age comes experience and a life well lived and so on and so forth. So I don't mind saying that. And I chose to stay and work with the underserved community in the South Bronx. I am bilingual, so that was a big reason as to why the patients there basically took care of me and talked me into staying around, because they're really such nice people. The majority of poor people are not what the Republicans say they are. They are not moochers. They are not. They don't want hand-me-downs. The majority of those folks were hardworking people who just happened to be poor because they didn't have maybe the right skills or the right language to be able to get better jobs. But they were trying, and they were living their life and raising their families just like all the rest of us do. We all put our pants on one leg at a time, and guess what? They do too. But anyway, to fast forward to my Florida years, my family and I moved down here because my mom was ill. And they lived up in New York, but I'm the only child, so we wanted to be with my mother. She had 5 good years with us, and I was glad to have that, since I'm an only child and two kids. So I was very happy that we were able to spend that time with her, and then we just stayed here. My husband is a physician assistant who is now working at FIU. I met him at Lincoln Hospital in the South Bronx, and he is an educator involved in training the future of healthcare, which is really like physician assistants, nurse practitioners. With the way that things are going, that's the way that it's going to have to be because of cost and so on and so forth. People like myself, yes, we still are needed, but we can have one of me and a few of them and seeing patients. But anyway, the reason that I chose to run for Congress, because you say, Alina, why did you choose to run for Congress? That's a really far leap from what you do. Well, I work down at the homeless shelter on Scott Street, which is very close to here, so most of you should know what that is. And for the last, I also worked up in Pompano, and I've also worked down in the mission in Miami. It's the whole Miami Rescue Mission thing. And for the last few years, I started looking at the political arena, not because I'm a politician and not because I was ever interested, but because I didn't like what was going on. I didn't like what was happening to kids, I didn't like the way our future was going, and I didn't like what was being done to seniors. And I know that's a big concern for all of us in this room, because if we are not now a senior, we will soon, or eventually, hopefully, if God willing, be seniors. So I started to get involved in the whole process, and I started to go to meetings and started to become aware of what was going on. And I saw that my congressman, Mario Diaz-Balart, and I will mention his name, yes, was not really doing anything for the people of the district, the real people of the district. He has been almost bending over backwards for special interests. And if you look at his donors, they're mostly out of state, and they're mostly wealthy people. They're not even in his district. The people don't support him. The more I started asking around about him, and being that I am Cuban and that I do speak Spanish, I also speak to the Spanish community, to the Latino community, and I started to hear a lot of things about him, how they really don't like him and wish that he would just sort of go away. And no one has really stepped up to challenge him since 2008 when Joe Garcia did it. It is a district that is R+5, which means that it is winnable. Only 5 points for the Republican side. There are districts in the state that are like 20 and 25. Either way, Democratic or Republican, it's a PI score or something. Somebody was trying to explain it to me. But the whole point is that it is doable. It is winnable if the right person steps up. So I said, well, why not me? I'm not a politician. I've always served the public in the capacity that I've been a physician. I want to continue to serve the public, but the people like you, people like, like me, like my friends, like my children. I have 2 children in their 20s, and I started to see how badly the future was going to be for them because of what is happening. Something as simple as the last thing that was passed last week, where we can't label GMOs anymore. So we can't know what's in our food. I can't know if I'm buying something that's not genetically modified. Well, that's the last thing that the Congress passed. And yes, Mario Diaz-Balart voted yes for that. Most of the Republicans did. A couple did not, and I give them props. But even someone like Elsie Hastings voted yes. So I'm sort of like this about that. I can't figure it out now. But anyway, so as far as seniors and Social Security and Medicare, of course we know that the Republicans want to privatize it. We all know that. They want to give us a voucher, and then we go to the lowest bidder, I guess, and try to get something for that. But as we know what happens, costs go up, costs go up. Vouchers usually don't go up. So what happens in 2, 3, 5, 7 years if they're still collecting Social Security? Unfortunately enough to still be here with us. And hopefully most of you will be, because people live to be 90 years old now. So that's not unthinkable. So what are you supposed to do when you reach 70, 75 and your voucher doesn't cover you anymore? Where are you supposed to get that money from? Most of us have not really planned for a future like that, because we thought that we would have Medicare to take care of us and Social Security to help us to live. And now they're telling us that no, you can't have that anymore because we want to privatize it. They want to privatize even the health care. They don't like Obamacare because they think privatizing is better. Well, you know what? It isn't. I've done both things. I've done regular insurance, and that was horrible because I was taking care of people that were uninsured. This is better, but you know what would be even better? One payer. One payer. So when you're born, you're covered. When you die and you're covered. For the whole life, you can become an entrepreneur. You don't have to worry about, I have to leave my job and lose my benefits. No, they go with you. If I turn 26, oh my God, now I'm too old to be on my parents' coverage, which is another thing that the ACA allowed us to do. I still have, my 2 children are still being covered under my husband's plan, because my daughter's 25 and my son is 23. So I am grateful for that, because we know kids, I'm healthy, I'm fine, I don't need health insurance, I'm going to pay for it, I'd rather go to a movie or go, out to dinner or something, and then what happens? A horrific car accident, something you can't plan for. And that could happen to any one of us. I'm not just saying that's particular to kids, but that's why we need to keep Medicare and Social Security for us and for the futures. It is not going bankrupt. That is a big lie. We all know that. There is plenty of money in there. Now, how can we make more money available? Well, why should we stop paying Social Security and Medicare because we make $17,000? So you make $118,000, $1 million, $20 million, $100 million, you pay no more. That's wrong. And if we can change that, and that's a congressional thing to change, which is why I'm running for Congress, because my issues are federal. If we can change that and have people pay into the system, it will go on for infinity. We know that. There's plenty of money now if they would stop borrowing from the fund, because we know that people have borrowed to pay for wars and for other things. Oh, there's a little deficit here, let's take from Social Security because there's a surplus. Well, yeah, there's still a surplus, but if they keep taking from our money, there won't be after a while, and then yes, they will have a reason to say, you see how it's going bankrupt? Yeah, but stop borrowing from it. We've all paid into it, we all deserve to get, because we paid into it. Now, as you also know, we paid for our seniors. Now our kids are paying for us. That's how insurance works, right? You pay for the people that need it at the time that they need it. Yes, the kids are going to be all because of too many tax taxes and whatever. Yes, I get that. But that's not true, and we need to face up to them and say, listen, you are lying, stop lying to people. And show them the statistics. I have the statistics. We can all look on the internet and say, look, you see, that's not true. So that's one thing that I want to work for, is I want to work to make sure that we not only keep Medicare and Social Security, but we expand it. Cost of living goes up, Social Security should go up. Just like we hope that at work you get a raise, and most of us haven't gotten a raise in how many years? But people who do keep getting raises are, guess who? Our Congress people in Washington, because they're the fox watching the hen house. They vote for their raises because, oh my God, they can't live on $174,000 a year. Oh, wow. Well, that's what they say. I've never made that much money as a physician in any 1 year. Never. Because of what I do. So you're going to tell me you can't live on $174,000 a year? Oh, come on, you're kidding me. Yes, I know you have to live there and you have to live here, but still. And you expect people to live on $7.25 an hour and calling them moochers, and then they don't have health insurance, they don't have pension plans, they don't have all the things that we're paying for these guys to have, because it's coming out of our pocketbook, so that they can retire comfortably, so that they can have better health insurance than they want us to have. That's wrong. And that's why it is time for people like myself to step up. There are others like me who are trying to make a difference and who are trying to change the status quo. That is enough already. They are playing with our future, they are playing with our hard-earned money, and it is time to say no more. We need to stop them. And that is why I am running for Congress. My name is Dr. Alina Valdes, and I am running for U.S. Congress District 25. And I thank